A trach change is the process of removing a trach tube from your child and replacing it with a clean one. This will need to be done once per week at home and as needed. Changing the trach weekly prevents the risk of mucus plugging and infection. Designate a day of the week that works best with your family schedule. The best time to change the trach is before meals or at least 2 hours after eating to prevent vomiting. When performing a routine trach change, it is required to use 2 trained caregivers. This will increase efficiency and safety during the trach change. First, wash hands with soap and water and gather all supplies needed. Towel roll may be helpful for babies and toddlers to visualize stoma site. Blanket, if needed, to swaddle infant or young child. Clean gloves if used by parents or caregivers. It is optional for parents. Healthcare providers are required to use them. Clean trach tie. Water-soluble lubricant. Current size trach tube. Size smaller trach tube. Changing the trach will most likely cause your child to cough. Be prepared with suction supplies and tissue or gauze to wipe away any mucus. Clean dressing. Ambu bag. Trach care supplies. Syringe, if child has a cuffed trach. Put on clean gloves if you choose to use them. 1. Attach one side of the trach tie to the clean trach and place the obturator into the new clean trach. 2. If your child has a cuffed trach, check that the cuff is working by inflating with the amount of air or water your child will need. Depending on the type of trach your child has, air or water will be used to fill the cuff. The information sheet in your trach go bag will tell you whether you need to inflate with air or water and the amount used to fill the cuff. If you cannot find this sheet, please contact your provider for more instruction. Make sure to deflate the cuff before insertion. 3. Apply a thin layer of lubrication to the tip of the new trach, but be careful to avoid touching the tip of the cannula or allow anything to touch it. 4. Swaddle child if needed. 5. Position child on his or her back with towel roll under shoulders or position of comfort that allows for easy visibility of stoma site. 6. Perform trach care prior to trach change. By cleaning the stoma site before a trach change, you are reducing the risk of infection and bacteria being introduced into the lungs with the reinsertion of the new trach. 7. Suction trach if not already done so during this process. 8. Once you are ready with the new trach, remove any oxygen, HME, or ventilator tubing. If your child has a cuffed trach, deflate the cuff, and then the second trained person will remove the trach from the child's airway, following the natural curve or arc of the trach tube. 9. Insert the new trach into the stoma using the same curving or arcing motion. Please remember to not force the tube in. The tube should slide in easily. 10. Once the new trach is inserted, immediately remove the obturator to allow your child to breathe. Do not let go of the trach. 11. Since the trach is not secured yet, communicate with the second caregiver. While one is holding the trach in place, the other is finishing the next steps. This is to prevent the removal of the trach, also called decannulation. 12. If child is on ventilator, quickly place back on. If needed, inflate the cuff with the right amount of air or water. Place back on oxygen, HME, or trach collar as needed and listen and/or feel for any air movement from the trach. 13. Inspect stoma site and re-clean if necessary. Sometimes during a trach change, extra lubrication and mucus reaccumulates on stoma site. 14. Place absorbent dressing around stoma site. 15. Secure the trach in place with new trach tie and dressing. 16. Suction whenever necessary throughout process. 17. Remove swaddling and towel roll if used. 18. Clean and save obturator in case of accidental decannulation. 19. Wash dirty trach tie in mild soap and water and hang to dry. Discard trach tie if it is falling apart, Velcro is not working, or stained. 20. Clean trach and previously saved obturator as described in your handout under the section Care of Equipment. Ask your nurse if you have any questions.